Good morning. It's February 21st, and this is a regular board meeting.
Commissioner Stottlemyre,
Present.
Commissioner Harris, Chair Waymeyer,
Present?
Commissioner Dunn,
Present.
Commissioner Dickinson.
Present.
All right, if you please stand and join me for the Pledge of Allegiance. I pledge allegiance to the flag
Of the United States of America, and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Morning.
Morning. Let's pray. Lord, thank you for this day you've given to us. Thank you for the beautiful weather yesterday and what is to come today, and pray that you would continue to be with these who lead. Give wisdom and guidance, Lord, in accordance with your good and perfect will as you reign over all things. We trust in you and pray that you would continue to bless where we live here in our city, our county. We ask these things, Lord, in your name. Amen.
All right. Any correspondence? All right. No public comment. Our consent agenda includes meeting minutes from our February 14th meeting, claim vouchers in the amount of $1,424,796.61. And that's it. Is there a motion to approve the consent agenda?
So moved.
Second.
Commissioner Stottlemyre,
Yes.
Commissioner Harris,
Yes.
Commissioner Dunn,
Yes.
Commissioner Dickinson,
Yes.
Chair Waymeyer.
Yes. All right, my business today, Christy Hilliker will give an update on the third quarter 2023 report and their operations at the for EMS. Good morning.
Good morning. So just starting with the third quarter report, you can see that our call volume remains down based what it was on the same time in 2022, as that our deposits, our revenue that we brought in also remained down. For adjustments, we did have $49,227.62 for adjustments. And then you can see what we sent to collections. Midwest, $5,981.84. And then to the Kansas Send-Off Program, $7,618.92. Were there any questions about that before we? Okay.
No?
So getting into the actual reports themselves, you can see that in the third quarter of 2023, Monday remained our busiest day of the week. By hours, again, we're consistently looking like we did in 2022, except we did have a spike in calls this quarter around 2 o'clock in the afternoon. In the third quarter, the majority of our calls were run in Franklin County. We did go into Johnson County 3 times and once into Anderson County to assist their services as well. If we're looking at our districts, the overwhelming majority of calls came out of the Ottawa South District, then followed by Ottawa North. When we're looking at where we're transporting our patients, again, you can see significantly we're taking them here to Advent Health, then followed by Olathe Medical Center, then Advent Shawnee Mission. If we're looking at exactly what we did by what we responded to, you can see that we had 870 911 calls, 156 interfacility transfers. We did 26 standbys. That would include fire standbys, public safety standbys, 9 blood draws, a medical transport. That would be where we took somebody back home from the hospital or to a nursing home. And then we actually took one to, and it says transfer to air from facility. So we helped facilitate a crew that landed at the airport to come and pick up a patient. So we helped assist with that. We're looking by our response disposition. Most of our patients, we do treat and transport them, but then of course we do have some patients that may have fallen and just need some assistance getting up, that they're not hurt. So that's going to be in that patient treated and released category. Just looking at our mileage, you can see that in July and August, we were averaging a little bit over 14 miles to get to our destination. In September, that went up to a little over 17. And the maximum distance that we went in July was 68 miles, August 56 miles, and in September 79 miles. We're averaging right around a little less than 2 minutes to respond to a call once the tones go off, taking us around 7 minutes to arrive at a scene. Typically, we spend about 20 minutes on a call. Takes us about another 20 minutes to get to our destination and about another 20 minutes to turn around and get back in service. The next one is just our age by years. The majority of our patients are between the 70 and 89-year range. And again, the calls you can see by service level overwhelmingly need a paramedic provider or an ALS provider. And then we have our overlapping calls. That's going to be our move-ups and status 0. You can see in 23 that in this quarter we did 109 move-ups, and we went to system status when all 3 of our ambulances were out 26 times. And I have the times broken down a little bit better for that on this last page where it talks about the time spent in system status. This is the time in minutes. So you can see August, we spent 325 minutes in a system status, which still does not account for 1% of our time. Does anybody have any questions about the operational report?
There was one, there's a thing there that said that sometimes you get a call and there's no patient found when you get there.
Correct.
So how did that happen?
So sometimes, for instance, we may get a call that there's a person down laying beside a car, and a bystander calls it in, and we get there and it's somebody changing their tire. Or we get there and literally we can't find the person. So that would be instances where we would have no patient found.
Do you have anything scheduled to remount, any ambulances?
So right now, we do not. Timeframes with those are about 2 to 3 years out. We did go ahead and go through the new maintenance policy that we put together, and we don't really have anything that looks like it's close to needing it.
Gotcha.
You might discuss with us, I know there's a Senate Bill 384 on ambulances. You might discuss that on what that might do.
So that Senate bill would allow rural ambulance services to just have 1 technician on an ambulance. Right now, it is required that you have 2 technicians on any ambulance. But Western Kansas is facing such a shortfall of providers that they very much petitioned to be able to have what's called an attendant on an ambulance. So they would have 1 attendant that, is my understanding, is only CPR trained, and then they would have either an EMT, AEMT, or paramedic on there. With it being available for rural services, I do not see that having an impact on us.
Basically a driver.
Correct.
Well, a motion would be to approve the third quarter 2023 adjustments and third quarter collections for 2023.
Motion approved.
Second?
Commissioner Harris?
Yes.
Commissioner Dunn?
Yes.
Commissioner Dickinson?
Yes.
Commissioner Stottlemyre?
Yes.
Chair Waymeyer?
Yes. Well, thank you. Staff reports, Derek?
Yeah, I believe we got this locked up yesterday. Tax sale coming up April 2nd, 10 a.m. in the historic courthouse. I will get that completely finalized, but just to get you out ahead of it, so that's been a long time coming, but other than that, I don't have anything. Thanks, Cole.
Thank you. Paul? No? Anything? Christie, anything else? Sheriff?
Morning, Commissioners.
Good morning.
On that tax sale, it does not appear there's going to be nearly as many properties on there as we've had in the past, too. So that's also a good thing. I just wanted to let you and the public know that there are going to be some people out observing traffic. As you know, seatbelt usage is one of the things that helps keep people safe during a car crash. The safest place to be in that crash is inside that passenger compartment, and the seatbelt help keeps you there. And so there, NHTSA, the National Highway Traffic Safety Administration, that works with all the state departments of transportation to do surveys and studies to see what seatbelt usage is percentage-wise, and that helps dictate. They use that data for grants and things like that, and to figure out how we get people to, how do we increase seatbelt usage? And most of the time it's education and things like that. But there will be some people out just monitoring traffic. They'll typically be wearing a vest, and they'll be there watching traffic, and it may look strange. It may cause some concern for people. So if somebody notices that, or you notice it, we will go out and verify that that is what's going on, but there's a good chance that that's what it is. But they do 2 different sessions. They're going to do the child safety observance once, and then they're going to do an adult check as well. So from now till about the middle of May, they'll be out doing the studies for child safety usage. And then in June and July, they'll be out again doing the adult stuff. I know when I was a traffic cop, the biggest group of people, the drivers that they categorized that had the lowest percentage of seatbelt usage was people who drive pickups. And if you've driven around our county, you'll notice that would make, if that holds true today, then a large percentage of the people driving in our county aren't wearing seatbelts. So hopefully we've changed that a little bit. But I just wanted you to know that will be going on. So there's really no cause for alarm if you see them out there with a notepad watching traffic, keeping count. But we will show up to verify that that's what's going on if it does cause somebody concern. But that's all I have this morning, unless you have questions for me.
I got a compliment for you, Jeff. Deputy Dunlap came out to my place last night to take care of an intruder that was messing around, and took care of the situation very professionally, and
Great.
he went away. So.
That's what I like to hear. I appreciate that. I'll pass that along. Thank you.
Thanks. David?
So we are close to opening up the Osborne Terrace, or Osborne Road Bridge. Right now, the contractor's working on kind of final dirt work and cleanup. And then we've got guardrails that are set to be installed on March 4th. Once the guardrails are installed, probably the next day, we will open that up to traffic. We will have a final walkthrough. Right now, it's scheduled for March 13th, where we'll look at punch list items and those sorts of things, but more than likely, it'll be completely opened shortly after that. So that's a good thing. On Old 50, we're still a couple of weeks out on that bid, but we do have 4 companies that have picked up plans on that, so that's a good deal. And we also have one more that we anticipate picking up plans and bidding on this as well. So all that's good news. And then next week, we've had a group of landowners on Finney Road, just east of Texas. There's about a quarter mile of minimum maintenance road that they would like to close. Plan to have all the paperwork and stuff in front of you next week in order for you to consider moving forward with the public hearing at a later date. So just wanted to provide that update.
Thank you. Janet? Don?
Yeah, I don't know if you've seen this one, Janet, but up at Topeka right now, they got a House Bill 2599 on open records, what they're talking about. And you hear any more on this one, you might give us a little more clue I know it sounds like it's just another one of these deals, the state imposing things on her office and other collections of information. But they're wanting to, want them to do the job without any recovery, recoup of time or money. That's what the House bill is all about. I mean, give me a break. Give them a break, And then the one other would hit Paul. I know there's Senate Bill 468. This is an unworkable, I'm reading, this is not my words. This is from KAC. And this is an unworkable legislation that would prohibit cities and counties that grant tax incentives or other tax increment financing for exceeding the revenue neutral rate. And this is, just another bone, to pick with us, where we're trying to improve our economic development through and this bill is produced by Senator Karen Tyson and Representative Sean Tarwater. So, it's just another thorn in our side to cost us, cover them and cost ourselves. So I did attend the Conservation District meeting last week. That's all I got.
The only thing I wanted to say was to publicly say that I think our road and bridge guys were rock stars during that weather event that we had in February. Mother Nature was definitely not our friend on that one. When that storm started, every school district was in session. People were at work, and by the time they were on their way home, our guys were pulling them out of ditches to get them home. We had 8 inches of not only snow and maybe more different, but I had 8 in my area. And every single road in the county had snow, heavy snow, blowing snow. And then it got cold. The circumstances were not good. We had equipment issues, but those guys showed up. They worked long hours to get our roads clean, maybe not clear, they could have done 2 passes on every road, and your road would have had 2 passes, but then it would have taken them twice as long to get down to the end. I just wanted to publicly tell them and the public that I think they did a hell of a job. And I am very proud of our departments, our guys and gals, and the way that they come to work. And me personally, I was at home going, I'm not going out in this. But they were out every day making sure that our citizens could get out. And I just wanted to say that publicly and just say I appreciate them. That's all I have.
Yeah, this is a National FFA Week this week, and this recognizes the young folks in potentially agriculture business in the future. So agriculture is still very alive and very important to our county and our state. So congratulate you and recognize FFA Week.
I agree with you, Ian. Glad you shared those kind, positive words, and look for a motion to adjourn.
So move.
Need a second? Second. All in favor? All right, we're adjourned.